Hello, everyone. Welcome back to another 2CK question. The question today is what could be the likely underlying reason for a 60-year-old patient who previously underwent allogenic hematopoietic stem cell transplantation from an unrelated donor with HLA matching to treat acute myeloid leukemia and also received conditioning chemotherapy to be experiencing persistent watery diarrhea primarily at night, along with exacerbating crampy abdominal pain and the emergence of a maculopapular rash 3 weeks after the transplant. So this patient had a transplant, and 3 weeks after the transplant has developed this watery diarrhea, this crampy abdominal pain, and this maculopapular rash. Now, this is going to be important to know. There's a triad to remember for acute graft versus host disease. And a mnemonic that I use to remember this triad is that the G is going to be for gastroenteritis. So the patient had diarrhea as well as abdominal pain. In the host part, I remember this as hepatitis, the H for hepatitis. They sometimes will give you in questions elevated liver enzymes. And this is also going to be part of the classic triad for acute graft versus host disease. And the D is for dermatitis. So the patient had a maculopapular rash. Now, the question was asking the mechanism of acute graft versus host disease. And imagine that someone is getting a bone marrow transplant, and the new transplant that they're getting might have these immune cells in them. So they might have the CD4 positive T cells, CD8 positive T cells, as well as macrophages. And CD8 positive T cells are going to be the main players in inducing this disease. So what they're going to do is they're going to come into this person's body, and so this is going to be the person who received the transplant's normal cell. Here's an example, and their MHCs are going to be presenting normal peptide fragments. And so what is going to occur is the CD8 positive T cells that were found in the bone marrow is going to recognize this as a foreign peptide and is going to attack the host. And so that is what is occurring in this case. So to answer the question, the answer choice is going to be answer choice C. CD8 positive T lymphocytes are going to be the main players in mediating injury in acute graft versus host disease. Now, answer choice A, delayed toxicity of conditioning chemotherapy. Now, this does not fit our timeline. The toxicity of chemotherapy with vomiting, nausea, those symptoms usually occur within a week of chemotherapy. So the 3 weeks is not going to fit our timeline. Answer choice B, cryptosporidium parvovirus infection. Now this can occur in people with weakened immune systems, classically with HIV patients. This is not going to be the answer because although this can produce a watery diarrhea, the fact that there's a maculopapular rash does not fit the um, the description. Now, answer choice D is post-transplant lymphoproliferative disorder. This is also going to be incorrect, although patients who receive transplants are going to be at a higher risk of developing lymphomas at a later on, but this is going to occur years later, usually not in 3 weeks. Answer choice E is antibody dependent cellular cytotoxicity. Now, as we talked about, CD8 positive T cells are going to be the main role players in mediating injury in acute graft versus host disease. So, this is also going to be incorrect.